BBC Radio Scotland.
And this is Good Morning Scotland with Gary Robertson and Bill Whiteford. Now, 224 in 1997, 545 in 2009, and 934 in 2017. Year on year, the number of lives claimed by drugs in Scotland is rising. Today, the charity Scottish Families Affected by Alcohol and Drugs is launching a campaign called Behind the Numbers. Its aim? To highlight the collateral damage inflicted by addiction.
Through her addiction, she has had some terrible experiences, and I've supported her because I love her and I wanted to help save her life.
And the minute you mention addiction, the barrier goes up.
The services were probably hardly non-existent.
People with addiction issues are already chaotic. They don't need the chaos for the services.
She was dicing with death every day because she wasn't getting any help with the services.
The whole service needs to change because right now it ain't working.
Well, Justina Murray is the Chief Executive of the campaign. She joins me now alongside Austin Smith, who's a Policy Advisor with the Scottish Drugs Forum. Morning to you both.
Good morning.
Thanks very much for coming into the studio. Justina, does that sound familiar, what we heard in the clip there?
Absolutely, it does. Behind the Numbers is all about highlighting that hidden role of families behind the scenes. We know that families all of the time are preserving life, are saving life. That's a whole lot easier for them when they're supported, when they're included in treatment and care, just as any other carers would be. But what families tell us is that's not their experience. They're ignored, they're excluded by treatment services, and they're really judged and stigmatised for their loved one's addiction in a way that you would never blame somebody for their family member having cancer or any other health condition.
Why do you think that is? Why do you think things have not changed? Because drug addiction has been around for quite a long time.
I think there's lots of reasons. I think that, families find it hard to find a voice, that services are often very clinically led and they don't really recognise the importance of having that holistic package involving all of the supports around somebody. And also I think there's social attitudes as well. The people who work in services, they're members of the community like you and I, and they hold that whole range of views around people with addiction. They judge them, they stigmatise them, and they don't really have a full understanding of what leads people into addiction and what can help them get out.
And I guess family members often say to themselves, is there something else we could have done? Is there something we did wrong? That sort of thing.
And I think that flows into services as well, that services do often blame family members. It's all the family's fault. And, services feel very unconfident about talking to families about what's going on. But we work with services all of the time to help them include families. There's lots and lots of really practical ways that families can get involved in treatment and care. And it's not a difficult process. And it's an absolute win-win for the service, for the family, and of course for the individual concerned.
Austin Smith, I mentioned that you're a policy advisor with the Scottish Drugs Forum, but I think you're going to give evidence today to the Scottish Affairs Committee. They're looking into the effectiveness of the criminal justice system. What are you going to tell them?
Well, far be it from me to preempt the evidence to the committee, but strictly between you and me.
There are people listening.
I think that the focus is likely to be on decriminalisation. What's happened over the last 30 years is we have de facto decriminalised drug possession to a degree in Scotland. So there are recorded police warnings for cannabis possession now as a standard procedure. Years and years ago, people used to be imprisoned for possession of small quantities of heroin. So that's all changed, and it's changed without a change in the law, and actually without any sort of political consensus around that. And, while we would support that drift, if you like, of policy, there is an argument for formalising that and having a serious attempt at decriminalising.
So sort of saying, look, this is where we are now, but it's not actually reflected in the law. Yes, firstly, and also it's anomalous. So cannabis, there's a kind of cannabis lobby, if you like, of people who have managed to push for the decriminalisation, as I say,
in fact, if not in law, of cannabis, but not of other substances. So the law reflects people's prejudices in that sense. And all that happens is the families that Justina's been talking about have the police at their door, as well as other things which they don't need, frankly. There's nothing achieved by the criminalisation of drug possession for personal use.
But just going back to the numbers that I quoted at the start, which are quite shocking about the number of drugs deaths, how do you explain that in a regime which has become more liberal?
Well, I would argue that there's no connection between that and the decriminalisation. What's actually happening is we have a group of people who, if we think of them as NHS patients, people who are typically using heroin, these are people who die, people who are using heroin and other opiates, and as a pattern of polydrug use. Those people are killed not because drugs are illegal or are illegal in terms of possession, but because of their physical health, which they're not getting help with, and because they overdose. And they overdose in Scotland more than elsewhere, partly because we have fewer people in treatment, because of the quality of that treatment when people are in it. It's hard to get into, but very easy to get out of. People are pushed out of treatment. So that's where the question lies. And actually, this is all within our control. I mean, this is all devolved to Scotland, and it's for Scotland as a society to think about how are we going to treat this group of what are in effect NHS patients who are treated like no other NHS patients.
But of course the difference, Justina, is that they have addiction problems, obviously, and you could say it's analogous to people who have addiction problems with alcohol. But the difference, of course, is that most of these street drugs are illegal.
Yeah, but I think, as Austin's saying, that's not really the key point in terms of reducing the drug deaths. Really, it's about people accessing good quality treatment. So I think we've often said, treatment's a protective factor in reducing drug death and drug harm, but only good quality treatment. So people need to be able to get in easily. They need to be prescribed optimal doses, so they're not then topping up with a whole load of stuff they're buying on the street. Families need to be included in the treatment, as I've said, which really also helps to reduce harm and reduce the risk of death. And so I think there's lots of ways that treatment can become more recovery oriented. It's not just about having a quick appointment once a month. It's about what are people going to do with the rest of their day? How can we help people rebuild their family relationships, their community links, so they've got fulfilling lives and hope for the future? What
about access to the drugs? Where is there some way that society should better control the drugs?
It's extremely difficult now. We have a lot of online purchasing. You can order with the apps on your phone. Families have said to us, even where they have taken their loved ones' bank cards and car keys, for example, at their request, the person's still been able to access drugs through their mobile phone, get delivered to the door, often disguised as something else. So controlling supply is obviously a job for the police, but it's extremely challenging.
Okay, well, listen, thank you both very much for coming in, and we'll keep an eye on the evidence to the Scottish Affairs Committee later in the day, and we'll report on that in News Drive too. But listen, thank you, Justina Murray and Austin Smith.
Thank you.
It's 17 minutes to 8.